friends, welcome to my YouTube channel. Now I am going to teach about a important topic, that is rheumatic fever. So let's study rheumatic fever. So what is rheumatic fever? It is a multi-system immune-mediated non-suppurative inflammation. So, rheumatic fever affects many systems of our body and it is immune mediated. Okay, and it is non-suppurative because here suppuration is absent, and non-suppurative inflammation, it is an inflammatory condition without suppuration. So, this rheumatic fever have some criteria. So to diagnose it, we have some major criteria and we have some minor criteria. So what are the major criteria? Let us see. Major criteria are carditis, inflammation of pericardium, myocardium and endocardium. Inflammation of these all the three layers comes under the carditis. And polyarthritis means it affects many joints, so it is called polyarthritis. And chorea, what is chorea? It is the jerky movements of the hands, feet, legs, arms. This is called chorea. Abnormal jerking of the body. Erythema marginatum, red rashes are formed, and subcutaneous nodule. These 5 are major criteria. So what are those? Carditis, polyarthritis, chorea, erythema marginatum and subcutaneous nodule. Minor criteria. What are the minor criteria? We found in clinical examination, minor criteria are fever and polyarthralgia. Okay. And what do we find in laboratory diagnosis? Elevated erythrocyte sedimentation rate, means elevated ESR or leukocyte count. And what do we find in echocardiogram, ECG? In ECG we found prolonged PR interval. Okay. And supporting evidence, those are elevated or rise anti-streptolysin O, a positive throat culture, rapid antigen test for group A streptococcus, and recent scarlet fever. These are what? These are John's criteria. You are studying here, these are the John's criteria. And what are the pathological manifestations of acute rheumatic fever? What do you find in heart, layers of heart? Pancreatitis means inflammation of all the layers of the heart, means pericardium, myocardium and endocardium. All the layers are inflamed in pancreatitis total. And what do you find in endocardium? In endocardium, these are divided into two, valvular and mural. What do you find in valvular? Vegetation along the lines of closure. There are some vegetations. When the valves close, along the closure of the valves we find some vegetations. And Ascoff's body. In mural, what do we find? Maculum's patch and Ascoff's body. Here also we find Ascoff's body. In myocardium, what do we find? Myocardium we also find Ascoff's body, and one is swollen collagen, lymphocyte and plasma cells and caterpillar cells. Caterpillar cells are also found in myocardium. This is important, caterpillar cells. Where do we find caterpillar cells? In myocardium. And pericarditis, serofibrinous pericarditis, bread and butter. This is also known as bread and butter pericarditis. So one important thing, Ascoff's bodies are found in all the layers, so that endocardium, myocardium and occasionally pericardium. Okay. So this is all about rheumatic fever.